All right, good morning. As you can see, we have this gigantic note here. We just added some changes, some minor changes, and we're going to focus on them right away so we can implement it in our documentation. If you look here on education, as you can see, the top part is pretty much still the same. Patient, caregiver, whether the education provided was verbal, written, or audio. The only thing that's new is this one, response to teaching. Make sure if we provide patient or caregiver teaching that they do verbalize understanding or they require more education. Going over here, which is the second board, a few things that are added. You can see the narrative notes are a little bit shorter to be able to accommodate these few changes. First things first would be the rationale for skilled services, and we need to select everything that applies. As you probably know your patients, you know what your patients need, and you will just check whatever applies to your patients. Patients will be discharged. Select all that apply. Usually what happens is that our patients have chronic conditions, so basically we do not really pay attention to that. However, as far as discharge, when skilled care is no longer required and able to function independently, and or if requires long-term level of care that cannot be provided safely at the home. One of the things also we need to check, discharge planned within the next 7 days, yes or no. And if the patient still needs care, we'll just mark this one, which is patient has ongoing skilled services needs at this time. If you go over here in this box, plans for the next visit, nutritional support, respiratory care, medication administration, wound care, IV infusion, you basically are going to select all that apply, as well as response to interventions that you provided. Did they tolerate it well or did they not tolerate? If they did not tolerate it well, you are going to document in the narrative. And that would be it. Thank you.